Hello everyone, with the temperatures rising across India, we are seeing many children coming to us with heat related illnesses. Now, heat related illnesses can be very mild, like just some loss of appetite, to very severe, what we call the heat stroke. So, what are the common symptoms which children may get because of exposure to excessive heat? Loss of appetite, headaches, stomachache, vomiting, fevers, then giddiness, feeling very, very tired, and dehydration, decreased urination, and rare cases, symptoms of heat stroke, which is a very high grade fever, and the confusion. Child is not able to understand what is happening even when you are waking up the child goes back to sleep. These are the more severe symptoms of what we call as heat stroke. Now, firstly, if your child is exhibiting any symptoms like excessive sweating or feeling very hot and feeling giddy or feeling very tired when you are outdoors, immediately shift the child to an indoor place, keep the child under fan. If the child is wearing synthetic clothes, make the child wear some loose cotton clothes. In case the child is having fever, you can start with sponging. For sponging, you don't have to use cold water, just use your normal tap water. Make sure the forehead, the underarms, and the groins, the cloth is changed frequently, and the whole body you can wipe. Give the child a glass full of some electrolyte rich drink. It can be ORS, it can be buttermilk, coconut water, lemonade, some refreshing electrolyte drink. Don't go for your Tetra Pak juices and processed juices which you get from outside. These will not help in dehydration. So I have mentioned what you can give if the child has been exposed to outdoor heat and is having any symptoms. Some children may have vomitings. For that, you can take vomiting medicine from your pediatrician and keep giving these electrolyte rich drinks frequently. Some liquids you keep giving frequently. Sometime after exposure to heat, children may not feel like eating for 2 to 3 days also, but as long as they are taking some liquids, as I mentioned before, that is fine, and some soft diet. Because of heat, children may have stomach cramps. If they are really bothering the child, you can give some medicine after consulting your pediatrician, but these stomach cramps are kind of a sign of dehydration. So give more and more fluids and electrolytes. Plain water will not work, so give something like ORS, coconut water, buttermilk, lemonade, panna, or some other cooling drink you can give your child. In case the child's fever is very high, 104 plus, the child's fever is just not going down with medicine and sponging, the child is confused, child is excessively sleepy, you wake him or her up and then she again goes back to sleep, severe giddiness, then in that case, please urgently take the child to hospital. This could be a heat stroke. Child will need to be given IV fluids for rehydration and measures to control the temperature. So in this summer season, best is to avoid taking children outdoors between 10 a.m. to 4 p.m. Even otherwise, if children are going out to play, make sure they have a glass of some nourishing drink, which I mentioned, electrolyte rich drink, before going to play and after coming back from play. And during play, send them with a big bottle of water and tell them to take at least 10 big gulps every 30 minutes. For younger children, give them a few sips every 30 minutes. So please stay safe during this summer season.